All right, welcome to the Kung Fu Mama Show. Today we have a very special guest, and we'll be talking about one of my favorite topics of motherhood, which is breastfeeding. We have Dana Chang here. She is a licensed nurse midwife from the U.S., and she is also a certified lactation consultant from the International Board Certified Lactation Consultant. And she is here. We're so lucky to have her because she just got back in 2019. And she is here providing lactation consulting for all you beautiful families of Taipei. So here we are.
Hi, thanks for having me.
Yes, we're so excited to have you here. Tell us a little bit about yourself. I know you're here in Taipei and you have two lovely children.
I do. Yeah, so I'm a nurse midwife in the U.S., but coming here, I was planning to focus on just hanging out with my kids, but I love what I do. And so since I can't deliver babies here, I noticed that there is a need for just more information and more support with breastfeeding. And that is definitely something I can do and something I'm also very passionate about. So I now do in-home visits. So if you have just had a baby or you're pregnant and still want more information, I come to you and we can talk about whatever it is that you want to learn about. And if your baby has arrived, then I help you, your baby latch, talk to you about any questions, concerns you might have, and kind of figure out a plan if there's something that needs to be altered or changed.
Awesome. So let's go back to that topic here. So we just had a baby. What are we going to do? For new moms, especially for me in the beginning, I had no idea what breastfeeding was going to be like. I mean, it was like, oh, so there's actually supposed to be milk coming out of here? Like they eat? Like what? what is going on? So where do we begin? So what are some tips you have for some, pregnant mothers and they're going to be giving birth and they do not know what to expect for?
Yeah, that's a great question. So I recommend that, I know in pregnancy, it's really common to think about the labor because that's the biggest thing on your mind is the baby coming out.
Yes.
But the baby comes out and it usually takes, maybe a day, 2 days or so. And then the breastfeeding journey actually lasts for a really long time. So while you're pregnant and kind of starting to think about what you'll need to prepare, I highly recommend people learn more about it, whether that be through lots of YouTube videos, talking to friends or family, reading books, or actually having a childbirth education class that covers breastfeeding, or I'm happy again to come to your house and talk to you more about it as well. Because it's really important, I think, just to know what to expect, what's going to happen. That's kind of part of the battle.
Right.
So in pregnancy, really your body's hormones have changed and it really helps, you might notice different changes in your breasts. They get bigger, the skin gets more transparent, you can see the veins more, the nipples become maybe bigger, the areolas get darkened, and that's all signs that your body already has those hormones that's going to help you. So there's nothing you really need to do to be able to breastfeed other than be pregnant.
Amazing.
Yeah. And then once you actually have your baby and your placenta comes out, that's actually the triggering thing that your body knows, oh, okay, I am now going to need to provide milk for this baby. So there's nothing you need to do besides have a baby for your body to really be ready.
Oh, wow.
Yeah, it's amazing. Do nothing. But learning about that and kind of not being afraid of that, I think is a really key thing.
Okay. So once you have the baby, the baby just came out, and then most women do skin to skin, is my understanding?
Yeah, so we highly recommend skin to skin. Every hospital kind of in every country actually has kind of different viewpoints on that. But the more skin to skin, the better. We know that babies, they regulate their temperatures better, and they want to nurse more when they are skin to skin. Our bodies actually we have a little gland around our nipples that produce a smell. And so that babies are sort of attracted to the breast just purely by being there. So as much skin to skin as possible, even if you have a C-section and don't get to have your baby right away, as soon as you can, ask to have the baby with you and direct skin to skin, no clothes, besides a diaper. And as much skin to skin as possible, put a blanket over both of you, I think is really going to be really helpful in kind of initiating those early breastfeeding attempts.
So right after you start your first skin to skin, are they supposed to latch right away or?
Good question. So I encourage babies just to explore. So as a mom, you've just given birth and that's been really hard. And so you need a moment too to just breathe and relax and be with your baby. Babies left skin to skin will start to kind of explore themselves. So they have different reflexes that allow them to kind of bob their head, and they actually, if left alone, will do what's called the breast crawl, which basically they can't crawl as like a normal baby can that's older, but they can move to get themselves situated to the breast. So there's some really cool videos that you can check out where the baby is just skin to skin and then kind of starts to move, and they actually get themselves to the breast to be able to nurse themselves. And so it's pretty cool what they can do. But I would say most babies would start that first breastfeeding within the first hour. So if your baby comes out, there's no need to get your baby right on the breast right away. Just enjoy those moments. And then when you feel kind of ready, the doctor or the provider is done doing everything else they need to do after the baby comes out. And you feel comfortable, then you can kind of get yourself into a nice position and help your baby get there if your baby's not already there. So within the first 1 to 2 hours is sort of the best time to initiate that first attempt.
And I guess the best way is to have like a natural breast crawl so they can get there and you just relax and have the baby there skin to skin. That's beautiful.
I think that is ideal. Would that happen in, a majority of the settings? Probably not. Just because there's usually a lot going on. There's nurses, there's doctors, there's everything going on. But really letting that baby skin to skin and kind of showing those signs they're ready by kind of bobbing their head around and maybe moving their arms. And then you and whoever with you that can help, you can kind of help guide that baby into kind of a more comfortable position for you both.
Amazing. So once you actually have already gotten latched, how do you know that your baby's actually drinking milk? I understand in the beginning it's not exactly milk. It's colostrum, right? So how do you know how long does that period last?
Good question. The colostrum is that first milk, and it's almost like a yellowy orange in color, and it's really high in immunoglobulins, antibodies, proteins. It's like, we call it liquid gold. There's nothing that we can make or produce that is the same. So if you're going to give your baby anything, that initial colostrum is the best thing you can do for your baby. And so that is there. It's present. You don't have to do anything to get it. It's there. And it's in small quantities. And it's there for maybe the first, maybe up to 3 days of life before then the milk starts transitioning. So milk that we think of comes in usually around day 3 to 5 for most people.
So what about those who have complications with latching? If they can't get the baby to latch within the first couple days, are they supposed to hand express the colostrum out, or is there a way to still have the baby consume it?
Yeah, good question. So, the baby needs to eat something. Right. But the baby stomachs are actually really super small. And so I think that is one thing that we don't always know, and we get kind of scared about as mothers who want to provide for your child, right? That's the biggest thing, is you want to make sure the baby has enough when you don't know. Exactly. And so to think about it in kind of visual terms, the baby's stomach on the first day of life is the size of a blueberry. Oh my gosh. So teeny tiny. They don't actually need that much. They're also born constipated, so full of that meconium, that first baby poo, that's kind of that black tarry poop. That is what their bodies are full of. They don't poop before they come out. Right. And so they don't actually need that much. The colostrum then stimulates their kind of body to move that through, and they poop it out. And so they're not actually eating because they're hungry. They're just kind of doing it to suck for comfort, because it's a reflex that they have, and also to kind of start stirring things up. So that colostrum is really only the volume they actually drink in that first 24 hours is like 2 to 7 milliliters per feed. It's so teeny tiny. So you don't actually need a lot, is basically the point of that.
Okay.
The stomach then grows between the size of a blueberry to a grape to a cherry. So it gets bigger and bigger every day. And that's what your body is going to be able to produce with that stimulation. Mm-hmm. So as long as it's stimulating either the baby nursing or hand expression or pumping, you'll get some. So if your baby is not nursing, which you asked about, then we do want to stimulate your body to know that it needs to produce that. Mm-hmm. So I mentioned earlier, when you're pregnant, your body has the hormones to make the milk.
Right.
But then that doesn't last, right? Mm-hmm. So those hormones, the placenta comes out, your body starts to produce milk, but now it needs your baby to demand it. So that sucking, that nursing, the emptying of the milk then is what makes your body continue to produce it. Right. So if your baby's not able to latch for whatever reason, it's in the nursery, it's just not latching well, any reason, then you should hand express to start with. And that is, do you want me to give you sort of an example of what that looks like?
Yeah, sure.
Okay. So typically, I have my model here. So typically, your baby's in the nursery, your baby's not with you, or your baby's not latching well, that you know of, or that a nurse or provider has told you. Mm-hmm. To hand express, what you do is first start out with kind of just some basic massage. Mm-hmm. So you want just kind of to get your body kind of ready, the tissues kind of loose and warm. Right. So you do any kind of basic massage. It doesn't have to be anything specific. Lots of times we do kind of like a rubbing motion.
Okay. Kind of in a circular.
Yeah, or kind of like just a tapping.
Okay.
And you do that for a few minutes. Make sure your hands are kind of nice and warm and clean. Cold hands usually makes us want to kind of curl up and not be ready to nurse. And then after that, you're using your own hand or your partner's hand if you're sick or uncomfortable and can't do it yourself. And you make kind of like a C. So you're going to put your hand kind of, this is the areola. You want to put it kind of a C kind of above it or the side. It doesn't have to be in a specific area. It's whatever's comfortable for you. Mm-hmm. And you want to push back and then together. So you're kind of pushing back towards kind of your backbone.
Okay.
And then you're kind of squeezing it together. And you do that a few times. If the first few times you do it, you don't get anything, that's okay. Because the baby doesn't get anything the first few times they suck too, right? They have to kind of suck and tell your body, hey, I'm here.
Right.
Let the milk down, and then your milk gets that hormonal response, lets the milk come out. And so I think what happens a lot of times is people are pumping or hand expressing and they're not getting a lot, and then they get anxious and worried about it. They think, I can't make milk, and it's not true. It's just that your body takes a little bit of time, just like it would with your baby. But when the baby does it, we get less nervous because we can't actually see it, right? So that's kind of a nice, easy technique to do if your baby is not able to latch for whatever reason.
Okay, great. So in those first couple weeks, a lot of the times a lot of mothers are concerned about if their baby is eating enough. And as you mentioned before, obviously their stomach is very small, so they actually can't eat that much. But is there a way to measure whether they are eating enough, or is it by times a day, or what? Yeah. What is there a way? What's a way to know that maybe you're doing the right thing?
Yeah, we all want to do the right thing.
Right?
Exactly.
Yeah.
So some things that you can tell, and it's not super specific, but when you nurse, usually your breasts feel kind of like firm and filled with milk, and then when you nurse, they might feel softer. So that's something you can tell the baby got something out. Okay. If the baby is pooping and peeing, we know they got something, right? They can't have anything come out if nothing's going in. The other things is that they're more content after a feed. So that's trickier because babies cry for lots of reasons. Right. But if they nurse and then kind of either were sleepy or content for a little bit, then we can again assume that they were comforted by whatever they got during that feed. And also listening for swallowing. So babies do that pattern of kind of suck, and that's telling your body to make that milk letdown happen. And then they'll do longer suck, swallow. suck, suck, swallow. And they might go back to the suck, 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 and want another milk letdown reflex. But kind of pay attention to those kind of long, deep sucks. And you can either watch or hear your baby swallow. And that's, again, another sign your baby's getting something. They're getting something, but is that enough? That's the trickier part. But typically in that first week of life, there's a guideline of how many diapers to expect.
Okay.
Yeah. So it's usually the number of days of life
Right.
is how many diapers.
Okay.
And so it's sort of a good thing to be watching for. If they're getting that, then you can be pretty reassured that they're getting as much as they need.
Okay. So, but only in the first couple of weeks. Right.
Yeah, in the first week.
Up until how many diapers or days?
Yeah, up until like day 4 or 5, that's a pretty good indicator. Past that, they should be having like 6 to 8 wet diapers. And also, babies are usually on average nursing 8 to 12 times within 24 hours. So if your baby's nursing less than 8 times, and is really sleepy, or you're having a hard time getting a latch, those would all be good reasons to talk to your provider or a lactation consultant who can kind of help you figure out, is your baby actually getting enough or not?
Okay. So what are some different types of discomfort that women might feel in the beginning? Because I know breastfeeding can be very painful sometimes.
Yeah. So in the beginning, I would say the biggest thing that people feel is just discomfort. And it's hard for them to know if it's discomfort because it's just a new experience for them, or if it's not quite right. And so I think the biggest thing to think about is we want babies to have a really big latch. And so what we mean by that is when the baby is latching on, if their latch is really, I'll use this again, if their latch is really shallow, so just on the nipple, kind of pulling, it's going to feel painful to you.
Okay.
And so it's going to feel, when the baby is done latching, your nipple might kind of look deformed or misshapen, and that's just because they've been really just sucking right there. But what we want is for baby to get a really big, nice open mouth and to get kind of almost most of the areola into their mouth as much as possible, and their lips to be kind of flanged out like a little fish, and the angle of the mouth to be as open as possible. And if that's going to happen, less pressure is going to go on your nipple, and it's going to actually pull more milk out. So not only will the baby get more, your skin will also handle that better. And so the first few times you latch, it's just hard to know, like, is this a normal feeling or not? But as it keeps happening, every time the baby latches, you want to always look or have somebody else help you look and kind of see what that baby's mouth looks like.
Right.
But what can happen is that your nipple will get kind of really red, really irritated. It might get cracks or bleeding. And if that's happening, it's just a sign that the latch is not deep enough, and that we need to kind of help you and your baby work on that.
If you have cracking or bleeding, it's okay to use oils or to use things to soothe the pain? Or
so typically your breast milk is actually really healing. So we talk about the benefits of breast milk in terms of babies and giving babies antibodies and everything, but it actually can help you heal really well too. So the best thing that I really recommend is if your nipples are sore and they're either cracked or not cracked yet, is to hand express some of your own milk and let it just dry there. Avoid using lots of soaps and products to kind of clean your nipples. That just creates more irritation. But there are some nice barrier creams too. So there's like a lanolin cream. There's a bunch of different brands who will make creams that you can use, and you can definitely use those. So after you feed your baby, you put that on, and it kind of helps the skin kind of stay
moist.
Yeah, exactly. And so that's fine to use. If you do have actual cracks or it's bleeding, there's also a gel pad. It's like a hydrogel pad that I think are really, really helpful. You can put them in the fridge and then place them on. You can reuse them, and they actually help promote healing as well. So that's something. And then sometimes you might need like an antibiotic cream for that cracked nipple. So if it is to the point where it's cracking, I think that you should talk to somebody, whether that be a lactation consultant or your provider.
Right.
Because an opening means that like bacteria can go in and it might lead to an infection, which we don't want. So prevention of all these things is sort of the key.
Yeah. If it might become infected, but when the baby actually drinks milk, or it's not recommended to even feed during that time?
Oh, great question. Always breastfeed your baby.
Okay, so even if it's infected or...
Exactly. Yep, it's totally fine. Babies can have that milk. Some moms will worry, oh my gosh, but it's like bleeding, and what if the baby is drinking then blood? As long as you don't have a contraindication to that. Right. So like a bloodborne infection like HIV or something like that. We always still recommend breastfeeding. Okay. Now that may not be comfortable for you to do.
Right.
And so if it's a really painful thing, which it can be, then what we might do is have you either hand express or pump and still give the baby the milk, but maybe take a break from your baby practicing the latch on that side.
But if you have like antibiotics, then you have to clean that off before.
So again, typically what you're doing is you're putting it on right after you nurse. So most of the antibiotic or the creams or the general creams are absorbed and fine by the next time you nurse. Okay. Let's say you put it on and your baby wants to nurse again in like 15 minutes and you're a little bit worried about it. By all means, take like a damp, wet cloth and maybe just a gentle wipe. But we're trying to not provide more irritation.
Right.
So the more wiping and everything that happens, and the more irritated that skin gets.
Okay, I see. So is there any other types of discomfort? Because I know that there's also sometimes that maybe there are chunks and it's hard on your nipples or already on the breast area. Yeah. What are some ways is it because it's clogged or?
Yeah. So I would say in the initial few days, the most common discomfort is more engorgement. So as the milk transitions from that early colostrum with just this little teeny tiny bit to more volume, the white milk that we think about, then your breasts often get to I call it like the Barbie doll phase, where it just looks like they're very large, firm, plastic-like breasts.
And Barbie doll. Nice. I haven't heard that one before. That's really funny. The Barbie doll boob.
They seem very Barbie doll-esque.
What do you do with the Barbie doll boob?
So that can be really uncomfortable for moms, where they almost don't want to nurse because it's just... to have anything touch it is uncomfortable.
Right.
But the key is to kind of let your body understand what that nursing pattern is. So we want your baby to nurse frequently to help out with that. Sometimes babies have a hard time latching because it's so firm that they can't get a good grasp. And so doing some hand expression or some massage or kind of gently pushing back on that pressure to allow some of the edema to kind of go back and let that nipple kind of come forward can be really helpful with that. Cold compress can feel really good. So after feeding, put a nice kind of cold pack there to kind of just relieve the discomfort. Engorgement might last a few days or it might last a couple weeks, just depending on how your body is adjusting and how often you can nurse and how well your baby is nursing. Lots of factors go into that. But it should resolve. And if it's not, then it's something we need to think about, because maybe your baby is not able to get out that milk and it's getting stuck there longer. So definitely talk to somebody about that.
Is massage one of the only ways to get rid of, say, clogged or too much?
So clogged ducts are sort of the next thing that come if the milk stays in there longer. So if you're not able to get it out, then it can kind of get one area that you might feel in multiple different spots. But it almost feels like maybe the start of like a little marble or a golf ball, or even bigger than that can be a clogged duct. And what that means is that the milk is just kind of stuck there. It's not going through like it should be. We have kind of milk ducts kind of all surrounding the nipple, kind of leading into this area. And one of those or multiple of them can get kind of clogged, which is what that feeling is. It's kind of stuck milk. So that happens for a lot of women. Things to prevent that is like avoid wearing really restrictive clothes. So people might notice if they sleep on their side or they wear a tighter bra, wherever it's tight, they're going to get kind of clogged because that milk is kind of getting kind of stuck in a spot that it doesn't want to be. So heat is sort of the best thing for that. So cold for the engorgement, hot for kind of a clogged area. So nice kind of moist heat. So either like put rice in a sock and warm it up, or in your hot shower, really do work on some massages. And massage is going to be key. It's just like a knot that you get like in your back, right? You got to loosen it up to get it out.
Right.
And so kind of deep, like massages that you would do on a knot is like that, or you can even start kind of higher up and you try to get that milk to kind of go in the form that it needs to get out, right?
Okay.
So start higher than the clog. Yep, exactly. And you can either do the circle massages or you can just push, kind of just hold firm until you kind of feel like a releasing of that kind of tension, and then go a little bit lower, a little lower and lower, and kind of go in that path that you think the milk is going to come out.
Okay. Great.
Yeah. Other tips for clogged ducts are nursing, pointing the baby's nose to the position of the duct or the clogged area. So kind of a little bit tricky to figure out. Maybe we'll use Bugs Bunny here. Yeah, why not? So let's say the clogged area is right here. So instead of the baby nursing here and having the nose kind of point to the side, you can position the baby maybe in the football position. So the nose is going right towards that clogged duct. So that way when the baby is nursing, it's, again, hopefully adding to that pressure to kind of really move it through the area that it needs to be moved in. Let's say the clog is, I don't know, down over here. Then instead of, again, nursing here where it's not pointing at it, you would switch the baby and have the nose pointing towards the direction of the clogged area. So different kind of nursing positions can be helpful.
Could you go through some of your favorite nursing positions?
Sure. I think, honestly, what most women do are the kind of the thing that makes you feel the most comfortable. And so I typically like to start out with all mamas using the laid back nursing position. Okay. And basically what that is we'll keep using Bugs Bunny here. So skin to skin again as much as possible. Right. And so you let your baby kind of lay here and you let your baby kind of wake up. Lots of times sleepy babies don't want to nurse very well either. So you want your baby to be nice and alert for feeding. So let your baby kind of rest here, and your baby again will sort of naturally come down and will come, let's say you want your baby to nurse on your left side. So you kind of guide your baby this way and then your baby will kind of nurse this way. So it's called a laid back position.
Nice. That's comfortable.
It's comfortable for you, and it's also a baby-led position, right? So the baby is getting themselves into a position that's comfortable for them, and there's not as much adjustment that you need to make. So baby kind of stays here and nurses here like this.
Very nice.
Yeah. That is, I think, a more popular position to be used now. So maybe your mom or your grandma might think you're a little crazy for using that position, but it's probably one of the best positions that's most recommended these days.
Oh, definitely. That's really cool because, obviously most moms probably think the typical, cradling the baby. That seems to be the most, commonly used, I guess.
Exactly, which is a nice position, but sometimes it can be a little bit tricky
because you have to hold,
use your hands and get a little.
And you have to get the pillows and the exact right height and everything.
Yeah, so laid back position is a really nice one.
That's nice.
In the beginning, your baby's neck is kind of all over the place, right?
Right.
And you have a hard time, as your baby gets older, 3 months, 6 months, they can have more head control and they can kind of help you nurse. But in the beginning, they really can't. So I like to encourage moms in the beginning to use their hands to kind of help guide them. So you'll take the hand that you're nursing on. So let's say, again, it's my left side. Right. You'll use this hand to get a nice, good sandwich ready for the baby. And use your other hand here on the neck. You never want to force their heads to nurse. You want to kind of stay nice and low and let them be in control. And then you help them on like this. And once they're on, you can switch and get more comfortable if that's more comfortable for you, but otherwise not. Right. The football position is kind of this position, maybe
where your feet are. Your feet are towards behind you, really.
Exactly. You're kind of curling them in, and if you have a larger breast, it's actually a really good position for you, easier to kind of help get the baby on latched. So you kind of.
So the football position would be with the head is more in the front, and the feet are going back towards the towards behind you here.
Yeah, and you can see how if you have a larger breast like this and they're hanging down, it's easier to get baby kind of tucked under than it is when they're this position. You have to kind of like really use your hands to do it. Right. So this is kind of a nice position for that. Lots of people like to nurse lying down.
Oh, yeah.
I'm sure you use that.
100% my favorite position. I'm very much guilty of dream feeding and sleeping and having the baby just like eat and mommy is out.
It's lovely, right? Because you get a little bit more rest that way. So a lot of moms really, really end up liking that position. In the beginning, it can be tricky because the babies are getting so little and they need more help. But as your baby gets older and you want more and more sleep, it's a pretty common position for people to use.
Yes, most definitely. Okay. So, thank you so much for all those amazing tips. I learned a lot today. I really enjoyed the names that you had for all the different types of I guess boob or different types of journey I guess that you go through with breastfeeding. So I really appreciate all the information, and if you guys want to get in contact with Dana, just send us all a message and we'll send you her way.
Perfect. Thanks for having me.
Thank you so much. Okay, bye guys. Oh, sorry, one more thing. Guys, storywear is always amazing. I'm wearing this beautiful storywear vest. Thank you very much for that. And I decided to button it so I could show my beautiful, almost 6 months belly now. I think I'm 5 weeks and 3. 5 months and 3 weeks now. So thank you so much for that. And see you all next week. Bye, guys.